Today, I'm really excited to talk to you guys. If you are wondering where you're at and if you're in the right place, this is our monthly Moving with MS virtual support group. I partner with MS Views and News, who is offering this monthly support group. I'm a physical therapist specializing in multiple sclerosis, and every month we meet and talk about a specific topic, generally in the physical therapy world, that can help you as someone with MS. We touch on so many different topics, and we partner with Viatris, who supports this whole program, so a huge thank you to them. And this topic this month is a little bit different. It's not specifically physical therapy related. I mean, it is in some sense, and you'll know what I mean by that after this talk that we have, but it's more about where is science right now, and specifically in terms of remyelination for multiple sclerosis. Remyelination is something that is so important to understand because there is a lot of research going on right now about remyelination, and it could have a big impact for those with MS. So what we're going to do today, I'm calling this Remyelination 101. We're going to be talking about what it is, what it means, and what is required in order for our brains and spinal cords to effectively remyelinate. And then at the end, I'm going to share some updates on some studies that I'm aware of that are currently happening specifically for remyelination. So before we dive in, feel free to communicate. Let me open the questions box. Let me know where you are tuning in from in the questions box, or I think it's called something different on your end, just so I can see that you're here. If you have any questions throughout, please feel free to ask those questions. I do want to share as well that I am not one of the researchers looking at these studies. I am just reporting on what I know. So I will do my best to answer all of your guys' questions. Also, we just don't have all the answers right now. It is still very, very early in the clinical trial game for remyelination, but again, it's just important that you know what's going on. So that's what we're going to dive into today. So Remyelination 101, again, my name is Dr. Gretchen Hawley. I'm a physical therapist and multiple sclerosis certified specialist. We're going to be talking about what remyelination is, what it's required, and remyelination updates. You'll notice that at number 3 is left blank, and that's because it's a little bit of the unknown right now. What we're going to be discussing is some of the therapies that are currently happening, where they're at, what we know and what we don't know about remyelination. Just a disclaimer, I'm not recommending, suggesting, or advocating for any of these specific medications or treatments that we discussed today. It's for educational purposes only, and unfortunately, we don't have all of the answers. So it is possible that you have a question, and it's a great question, but the answer just doesn't exist yet, since this is still pretty early on in remyelination studies. Okay, I wanted to first review myelin because remyelination has everything to do with myelin. And as we all know, multiple sclerosis is a demyelinating disease. So you'll see in this top picture, this is a normal neuron. We've got our cell body right here, our nerve axon, nerve fiber down here, and then these nice bright yellow spots are myelin. When we have myelin, this plump and lovely on our axons, it allows messages to be sent from our brain to our muscles very, very quickly, milliseconds. But with MS, the myelin is affected. It's demyelinated. So you'll see down below an image of what it might look like in multiple sclerosis. So we have this axon, and there is still some myelin. You'll see right here, there's still 2 myelin circles or ovals there, but you'll see that there's also damaged myelin. And in this picture, you'll see it's very damaged. In some cases, it's not fully damaged. You might still see a little bit of yellow, but then there's also some purple or black because it's dying off a little. So it's not always as clear as good myelin, no myelin. There's definitely a middle gray area. But with remyelinating, the goal is that we get as close as possible back to what the myelin looks like in this normal neuron. So remyelination, what does this actually mean for us? Ideally, what researchers are assuming is that a remyelination therapy, whether it's one or several, could restore the conduction of those impulses along those axons, meaning that the translation from our brain to our muscles is there and it's happening quicker. It also could protect those axons from further damage, which would be lovely, and it could recover previously lost function. They're also thinking that it could lead to improvements in daily functioning. It could reduce symptoms, it could slow the disease progression, and preserve your brain volume over time. So, there's no cure for MS, and remyelination would not be a cure either, but the way that it's being discussed in the research world is this might be as close as we get to a cure. And the reason for that, there we go, is because it's directly, essentially reversing the demyelination, which is what causes the symptoms from MS. So what we know so far, we know that remyelination naturally occurs in the brain, even with MS. And I think this is so important to share because one question I get a lot is, well, I'm 70, will this still work for me? Which is a great question. Or I have MS, does this still work for me? I have secondary progressive MS or relapsing MS, will this still work for me? And the answer is yes. Remyelination is something that naturally occurs in every person. It does slow down as we age, MS or not, but it does occur. And so there are things that we can do now to help with remyelination, even with MS. We're going to touch on those things today. Some studies, and I'll tell you what those are, show promising improvements, but full symptom reversal has yet to be achieved. We have not seen that in any of the studies yet. Also, something to keep in mind is that these studies that I'm about to share with you are done in mice, and mice what they inject in mice is not specifically MS. It's a mouse version of MS. So there might be some differences there. Additionally, what's the word I'm looking for? The size of the brain. I'm forgetting the word atrophy. Brain sizes, the size of a mouse brain is very small compared to an adult human brain. So while we are seeing promising results thus far in mice, as well as some human trials as well, but specifically in mice, one question lingering is, okay, well, will this work for a bigger brain, a bigger spinal cord? So we'll see, just kind of keeping you in the loop with the behind the scenes discussions that are happening. All right, so as I mentioned, these studies are done in mice, they're done in cats, and what they have found is that they are able to remyelinate, but the new myelin is thinner than normal. However, it's still functional, which is amazing. What this means is that if we were to go back to that picture on that very first slide, and it was this nice plump yellow myelin, what this means is that if remyelination is able to get you even just a little more yellow myelin, little more plumpness, not full like you were in the beginning, but just a little bit more, it can still make a difference. Your function, your mobility, your symptoms can still improve. So it's not like we're looking for perfection here. Even just a little bit of remyelination can make a big difference. Examples for the cats that were studied, they had demyelinated optic nerves, aka they had vision loss, but they recovered vision with the remyelination therapies. And remyelination in all of these studies have occurred while demyelination was happening. So they didn't have to fully stop the disease progression in order to see these changes, which I think, again, is a really great sign that it's not like we need to cure MS and then remyelinate. Remyelination can work alongside demyelination. Okay, so some definitions. There's two main definitions that I want you to understand. One is OPCs and the other is CSPGs. So OPCs is something you'll hear me talk about in the next several slides. These are oligodendrocyte precursor cells. In some studies are referred to as oligodendrocyte progenitor cells. All you need to know is that these are cells that mature into oligodendrocytes. And this is really important because these are the cells that make myelin. And so that's what we want. We want more of these OPCs and oligodendrocytes. The CSPGs are chondroitin sulfate proteoglycans. Again, you don't really need to know that full term, just wanted to let you know what it stands for. And what these cells do is they prevent remyelination. They make for a really crappy microenvironment so that the OPCs can't do what they're supposed to do, and therefore more myelin isn't really possible. So we want more OPCs, we want more of those cells to mature and make myelin, and we want fewer CSPGs. Another thing that's required, and this is something that has been really fascinating to see even over the last 1 to 2 years, is that up until the last 1 or 2 years, the research that I have seen for remyelination in multiple sclerosis has mostly been focusing on making more myelin. And so we need to have an adequate number of those OPCs and oligodendrocytes. Those are the ones that make more myelin. And we also need that differentiation of those OPCs, which basically just means we need those OPCs to mature into oligodendrocytes. And that is the part, those first 2 bullet points are the part of remyelination that researchers have been focusing on, which is great. And what they're finding is they are able to produce things that make more myelin. But what they've also found is that it's not making too much of a difference because that microenvironment part of our brain, it's not allowing that myelin to work and to do its thing. So other things that we need to have in order to successfully remyelinate is those axons, those nice long nerve fibers. They need to be receptive and willing to accept that myelin. We also need to have sufficient tropic or brain support. We also need those CSPGs down, and we need any type of debris that's in the brain due to inflammation. We need to get that under control. And we also need anything that is contributing to lesions to be inhibited. So these are a lot of things. And one thing from my mindset that's really great about this is this gives us so many different avenues of what we can look into. So if one isn't really working, great, let's focus on one of these other categories. So I do imagine that over the next several years, there's going to be so many studies on remyelination coming out. And what we'll be looking for, or what I'll be looking for and then sharing with you, is which of these bullet points is this specific one targeting? Is it trying to make more myelin? Is it trying to make that axon more receptive? Is it trying to limit the lesions? Is it trying to reduce inflammation? Which is it? And it also makes me feel like at the end of the day, when we have remyelination therapies, because I do think we will, I don't think it's going to be just one. It will likely be more than one that can focus on these different areas. But those are just my personal thoughts. Okay, moving on. So one question that I get anytime I share remyelination is naturally occurring in all brains, a big question I get is, but why isn't it happening now? Like, why am I not noticing that with MS? And there's lots of reasons, but they boil down to these three. Number one, those repair cells often get stuck and can't finish the job. Number two, inflammation creates a hostile environment. And number three, old or scarred lesions can block repair. So again, these are some of the areas that we want to be focusing on with remyelination. We need to control that inflammation. We need a nice microenvironment, or I keep saying microenvironment. And when I say environment, I mean the environment of your brain. Like you walk into a jungle and it is just flourishing. It is bright and green and sunny and wet and like exactly what it should be. Not you walking into a jungle and everything is brown and dead. Right? We want to make sure that our brain is as healthy as possible. So anything that you're aware of that we just know is good for our brain is going to be a really good option for you. And we'll get into some of those things. So we've already reviewed this a little, but just to reiterate, to promote remyelination, these are the things that we need. We need to create more of those OPCs. We need to mobilize them and make sure that they mature into those oligodendrocytes. What I mean by mobilize is we don't just want to get them in one area of our brain or our spinal cord. We want them to go everywhere. And then number three, we want to improve that microenvironment of our brain by reducing the CSPGs and modulating and reducing that inflammation. So what we now know is that there are specific types of MS that might be more receptive to remyelination. What they are finding is that people with MS who have active lesions may have the best ability to repair. And normally we hear active lesions and we're like, oh no, like that is not good, which is true. But in terms of remyelination, you might actually have the most success. Inactive lesions can still repair, and they're finding that mixed, so inactive and active lesions may be the hardest to remyelinate. However, what we're looking at now, what researchers are looking at now to see is this working or not, is there are 3 different types of scans now that can detect remyelination. So it's no longer based on did their function improve or did XYZ improve. They actually have visibility into the brain to see is remyelination occurring. Additionally, stable lesions might be signs of healing, and the focus is less on the total number of lesions and looking at what's happening inside the lesions. So again, there's technology now that will look inside each lesion, and that's what they are basing success on. So one beautiful thing about these studies now is that we know that there's these 3 main areas. And again, back, I don't know, 5+ years ago, the biggest focus was on number 1, the stimulating OPCs, making more cells that create myelin. Nowadays, there's still that, but it's more on improving the lesion microenvironment. I'm going to get into a few studies and treatments that are currently being tested, but as a brief overview, for stimulating the OPCs, the drugs that have been found to be successful to do this in mice were benztropine, clemastine, clobetasol, micanozole, and metformin. Then number 2 is mobilize the OPCs. And a beautiful thing about this is exercise. According to research, exercise is one of the best ways to mobilize the OPCs. And so exercise can increase it's called oligodendrogenesis, aka the creation of those oligodendrocytes, even after demyelination. Additionally, exercise is known to promote remyelination. They can see this on a cellular level, and I'll show you a really cool picture in a second here. And then number 3, improving that lesion microenvironment by reducing those CSPGs. One of several medications is furosemide that they think might possibly be helpful for this. And then modulating the inflammation, possibly through niacin, there's been discussion of that, and as well as disease-modifying therapies, nutrition, general brain health strategies. So the cool thing about this is that we do actually have things that you can do right now to improve your brain environment and to mobilize the myelin that you do have. So it's not like all hope is lost until we have a medication that makes more myelin. You can actually start doing these things now so that when there is a medication that can make more myelin and help in several of those bulleted areas we discussed earlier, you're set up for success. You're going to hit the ground running. Clemistine, this is one that has been studied for, I would say, maybe the longest. This was one of the first ones that I was aware of. And what the Clemistine studies have found is modest signal speed improvement, meaning there's some speed improvement in the transition from the brain to the muscles, but it caused significant fatigue. However, newer studies are looking at clemistine plus other medications plus exercise. The next one was the anti-LINGO study. This is testing opicinumab. This helped with some transmission from the brain and spinal cord down to the muscles. It did help a bit, and it was well tolerated, but limited overall benefit. The next one is bexarotene, and this worked in younger patients with MS but had serious side effects. And then benztropine was found to enhance the differentiation of oligodendrocytes, aka the OPCs, and what we want to make more myelin. So this is what I was really excited to show you. I want you to focus on this part up here. So these are pictures that were taken with these special scans that I was telling you about that showed exercise and its effect on our brain when combined with medication or no exercise. So you'll see over here in the control, so basically what we're looking for is the more splatters, the better. The more color, the more activity there is happening in the brain. And so this is just what was happening without anything, just on its own. This is what happened when they were on clemistine alone. This is what happened with exercise. And then this is a combination of clemistine and exercise. Excuse me, and you can see over here as well, this is the control, this is the amount with clemistine, exercise, and both. So it might be hard to tell in these pictures, but essentially what they found was a combination of clemistine and exercise was the best for your brain to have the most positive activity. If you weren't doing a combination, exercise alone was more helpful, and not too much, don't get me wrong. If you look over here at the yellow and blue, it's not a crazy difference, but exercise alone was more helpful than clemistine alone. And all three of those options are better than control. So just going to show you how important exercise actually is for remyelination and for our brain activity. So often people assume that exercise is just for our physical health, and it is, but it's equally for our brain health, especially when it comes to remyelination. Okay, so these are some drugs that are currently in clinical trial that I wanted to loop you in on, because these are the ones that are looking most promising from what I have seen thus far. So PIPE 307 is one. This is currently in phase 1/2, and the way that this works is it's attempting to mature those OPC cells so that we get more cells that make myelin. It's still in progress, but early data is very promising. The next is ABA-101. This is in phase 1, so it is early, and this one is targeting the neuron glia signaling pathways. There's limited data on this, but early trials are showing that it's safe. CNMAU8. This one is interesting because it uses gold nanocrystals. It's in phase 2 trials, and it's looking to boost brain cell energy and reduce stress in the nervous system so that the cells that repair myelin can actually do their job. This is a perfect example of this one not having anything to do with making more myelin. This will not make more myelin, but it will help with remyelination, assuming studies say that, assuming this trends positively. This is an example of one that would help due to helping the environment of the brain. This has been studied in MS and ALS, mixed results so far. And then last but not least is NVG-291. The phase 1 is complete. This inhibits a specific receptor so that the myelin can do its job. So again, NVG-291 is focusing more on the brain environment than it is actually making myelin. But it will directly have an impact on the myelin as well, because the myelin can only do its job if the environment allows it to. So by improving the environment, naturally, even the myelin that our own body is producing will be more effective. For NVG-291, clinical or spinal cord injury trials are showing remyelination and motor repair. So the hope is that this also would happen in multiple sclerosis. The phase 1 results showed that it was safe and that it does penetrate into the brain, which is going to be really important. So why exercise? Hopefully just those pictures earlier has convinced you that exercise can be helpful. But again, it increases oligodendrocyte creation, those cells that make myelin. It can promote remyelination on the cellular level. It can work at any age and any fitness level, and even moderate activity helps. This doesn't need to be an hour a day or even 30 minutes a day. Any activity helps. So I don't want you to count yourself out of exercise, even if you are sitting most of the day, wherever that might be, in a wheelchair, on your couch, and a desk job. You can do so many exercises seated that can get your brain on the right track and path for success with remyelination. So what this all means for you, and I do want to share a bit more that aren't on these slides, but your brain still wants to repair. And I just think knowing that is so powerful. Your brain, it can feel like it's working against you, and it might be, but there is a part of your brain that does still want to repair, and it is trying to. We got to set you up for success so that it is more likely to, even prior to these remyelination therapies helping and being released. Lifestyle choices influence repair success, and I thought this was so fascinating. Researchers have found that there is a direct correlation to isolation, and the more you isolate, the less likely you are to remyelinate. So isolation is easy with MS, especially if your mobility is limited, especially if your fatigue is limiting you, especially if your brain can't handle conversations. But if you can find a way to isolate yourself less, even just 1% less, that can make a big difference. And then new treatments are closer than ever. I did want to share with you this website. It's called clinicaltrials.gov. I'm going to click it so we can all go there together. It's a really helpful website where you can stay up to date on any clinical trial. And what you want to do, and it's US based, but you want to put in the condition or disease. So you'll put in multiple sclerosis. And then I'm going to do pipe 307, and it is pretty picky. I might have to come back and remove the dash. I might have to just put pipe, but we'll see. So I'm just going to do that. And then if you wanted, you can search by location, but I'm just going to do search. And this is where you'll see what studies have been completed, which one is active and ongoing, but not recruiting. Again, more completed. So it looks like these are only 3. And then you can try something else. You can try what's here on ABA 101. One right now, active not recruiting. So this is a really, really helpful site to get updates. I will say research takes a long time. And so I wouldn't recommend checking this monthly because realistically, there won't be updates within a month, but when there are new medications in clinical trial, or not even medications, this shows all studies. So even studies on nutrition or exercise. And the beautiful thing, we didn't come across any right now, but it will show you which ones are recruiting and it will tell you where. And if it's close to where you are and you want to participate, it gives you the contact information to reach out. So again, just really, really helpful. Okay, I'm just gonna quickly look in the chat. Janet from Michigan. Ray from South Africa. Welcome, Ray. That is so exciting that you're here with us. Pam from Long Island. Someone from Atlanta. If you have time, please explain how those unplump myelin cells relate to spots on MRI. So the spots on the MRI are due to the lesions. I'm trying to think if I've ever seen a resource that shared. To my knowledge, those unplump, for lack of better words, myelin those are not the same thing as your scars. To my knowledge, it's the lesions, the lesions are the scars. This is how MS is affecting your nervous system, though. I do believe they are two different things. So those spots on your MRIs are not the unplumpness of the myelin. I will look back into that and just confirm that to see that, make sure I'm giving you correct information, but to my knowledge, that's what that is. One of my first MS symptoms was optic neuritis, which resolved possible remyelination. So it is pretty common that your first symptom might be something vision related, optic neuritis, double vision, blurred vision, etc. And it is pretty common for it to resolve on its own, either fully or partially. To my knowledge, we don't know why that is, so maybe remyelination. That's a good thought, but I'm not exactly sure on that. What I did want to share with you, so some other things that have been, that you might hear floating around the interwebs is niacin. We talked a little bit about that earlier. The updates on niacin is that it could potentially promote repair and neuroprotection. And the reason that might be the case is because it removes the toxic debris from the lesions. And then the other thing I wanted to share with you, I don't know if you guys have been hearing that buzzword of metformin and remyelination, but there's actually been quite a bit of talk about it lately. And so I wanted to share my thoughts on that because there is some good stuff about metformin, but also some precautions that you need to consider. So for the good stuff, metformin, for those that don't know, is a diabetes drug, and researchers are thinking it might restore myelin in aged brains. So this could be better if you are, if you've had MS for a very long time and or if you are older. It works by rejuvenating those OPCs, and they've found this to be true in lab models using animals. They found through the technology and scans that it did repair and form new myelin. If you want to keep up with those studies, or studies specifically for metformin and progressive MS, it's called the Octopus trial. A phase 2 trial is currently happening where it's evaluating metformin's remyelinating and neuroprotective effects in non-active progressive MS, and this is happening in Belgium. And then another small phase 2 studies in relapsing MS with obesity found fewer MRI lesions with metformin. So all of that is sounding great. However, I was at a lecture recently where they were sharing this and they were like, but, be careful, and here's why. So precautions, it requires B12 supplementation because metformin can deplete B12. Up to 30 to 75% of the people taking metformin experienced GI issues. Vitamin B12 depletion, I just set it up above, which could cause long-term anemia if it's not corrected early on. So you need to check your B12 levels regularly. A rare risk, but severe risk, was lactic acidosis. The FDA contraindications include severe kidney impairment and unstable heart or liver conditions, and basically only do this with medical guidance. You wouldn't want to just do this on your own and just get metformin and start taking it just for funsies, thinking that it's going to help you in your condition. So I wanted to share that with you as well. I'm trying to think if there's anything else. There's so much happening in this space, and there's a lot of I don't want to use the word updates because again, things are constantly changing, I guess is what I'm trying to say. And it's so important to stay up to date on this information. And it might be a while. It might be 5 years, 10 years, 15 years before any of these are actually approved and we find that, yay, this is working, this is going to help. But in the meantime, again, I keep harping on this, but it's so important. There are things you can do. Exercise can be immensely beneficial. Any brain health hack, de-stressing, which can be a tricky one, proper nutrition, staying hydrated, not isolating yourselves, all of those are playing a role in remyelination behind the scenes. So I hope you found this helpful. I'm going to do my best to answer your questions. Again, I might not have the answer. It might not exist, but let me go through and see what you have. Thank you, Dr. Gretchen. Unless I am work, I tend to isolate myself because it is difficult at times to attend events. Yeah, and you know, just a reminder that isolation doesn't have to mean, or not isolating yourself doesn't have to mean going out somewhere. It can, but it could also mean social events on the internet. It could mean this, you know, but not necessarily this, because in this setting, you can hear me talk, but you can't talk back to me. Though it's going to be most beneficial if it's a back and forth communication with others, but you can do that on virtual events as well. I will work on getting out more to reduce isolation. Niacin in high doses. So great question. So we don't know yet. Research. I keep saying we. I'm not a researcher, but what we know from research is that we don't know yet what dosing for any of these. I have not seen anything that says, you know, this many milligrams of niacin is what was used to see these results. Either they are sharing it and I haven't seen it, or they're purposely not sharing it because they don't want people to just go get niacin, which can be pretty easy to get for other conditions, other things. I mean, I'm pretty sure you can just get it on the shelf. It likely would not be a dose that you could just go take on your own. Also, the way that it's administered might make a difference as well. Increasing exercise and OPCs, yes. How do we remyelinate? So I'm not sure if you came in late, Andrew, but so what we focused on today was different clinical trials, which would be medications that could help with remyelination, or that could help with remyelination in one of many ways. You know, how do we remyelinate? Let me go back to sharing this slide. So these are all of the things that we need to have in order for remyelination to even have a possibility of working. And so how do we remyelinate? We could possibly remyelinate by having a therapy, a medication likely, that increases the number of OPCs so that we can make more myelin. Also, exercise and other ways of differentiating those OPCs so that those OPCs can travel to different parts of our brain and mature into oligodendrocytes. We also would need something that can make the axon more receptive. That one of those clinical trials I mentioned at the end is focusing on this. We need sufficient tropic or brain support, which would be any, again, there's a ton. I recently gave a lecture on this and it was an hour long just on brain health and all the things that we can do. But again, to quickly recap, exercise is going to be important for brain health, not isolating, staying hydrated, nutrition, working your brain, maybe puzzles, things like that, you know, just to name a few. Clearing the debris, getting less inflammation, which could be through disease-modifying therapies. It could be due to it could be helped by meditation or anti-stress strategies. It could be nutrition, lots of options there. And then lesion inhibitors must be overcome as well. So how do we try to inhibit or prevent more lesions? So this is kind of a high level what's required to remyelinate. It was a really interesting conversation at a conference I was recently at around inflammation, because what they found was with remyelination, we do need some inflammation in order for remyelination to work. So while a ton of inflammation is not ideal, some inflammation is actually helpful. And the conversation became, you know, well, how do we know what a good amount is versus a bad amount? And so many therapies and medications lately are focusing on completely getting rid of inflammation. And so now the discussion is, do we actually want to do that? Do we not want to get rid of inflammation fully? So it's really interesting. It's definitely a time of lots of insights and learning something and then changing the approach and trying something new. So lots going on. Okay, going back over to the chat. Thank you for reminding us that interacting virtually is helpful. Yes, absolutely. In the past, I've taken high-dose niacin for blood lipid levels. Thank you so much for another job well done. You're welcome, Kevin. Thank you for encouraging us to exercise, reminding us every bit of movement is important. It really is. Are there good ways to walk better besides exercise? Yes, I mean, this is such a broad question, and it's going to depend on what is currently making you not walk the way that you want to walk. Obviously, I'm a little biased towards exercise as an MS specialized physical therapist, but you know, if you don't want to improve your strength or balance, but you want to improve your drop foot, there are sneakers or ankle braces that could help with drop foot. Often though, when you use tools like that, if they're not paired with strengthening, then your muscles will get even weaker because they allow you to not use those muscles. So it is a little bit dangerous when you start to use tools only. There's a device called a hip flexion assist device that can help with lifting your leg. It's a little bulky. I often don't recommend it to a lot of people, but it does exist. So there are different tools. And we actually have one of these Moving with MS lectures where I call out a bunch of my favorite tools. We have one in the past. I'm not sure. It's probably up on MSCS News YouTube page if you wanted to go find that one. Would increasing mitochondria help? You know, I haven't seen a whole lot of research reported on mitochondria, but I don't see why it wouldn't help. That kind of seems to me like mitochondria is such a good thing for us to have, and so it wouldn't hurt having more of it in my mind. Will this be recording sent to us by email? So I'm forgetting if you guys on this call are aware, let me know in that chat so I can read it out loud. I believe Jennifer from MS Views and News does email everyone with the link to the recording. However, if not, the link stays the same, and I have that link. Let me grab it for you. With MS. So obviously it's not going to be up yet because we're actively recording right now, but generally speaking, these recordings tend to be up on their YouTube page, I would say anywhere within 1 week of us ending this call to 1 month. So I would keep checking back. Or you could just email Jennifer and ask her to let you know once it's been posted. Hi, Dr. G. Hi, Kim. Exercise creates some inflammation in the body, right? Maybe it's a healthier way. Yeah, there's so much that creates inflammation, and some of it is healthy inflammation. Like exercise is good, but it can cause some inflammation. So yeah, absolutely. You know, I really do think that at the end of the day, once we have a remyelination therapy, what I'm really hoping is that people don't think it's just going to be, okay, great, let me take this pill or let me get this infusion, and that's all I have to do. Based on the research and what it's showing us now, I really do think it's going to be a combination approach. And in order to get the benefits that you're hoping for, it will have to be the medication and definitely exercise, working with a physical therapist to see what exercise is doable for you. And as along with other brain health strategies, it might even be with guidance of a specific nutrition program. You know, I really do think it's going to be a combination approach. And I think if you have that mindset, then you're going to be much better off versus if you have the mindset of, I'm just going to wait for the remyelination meds to come out, you know, and then I'll just take it once it comes out. And again, it might be more than one medication. It might be a remyelination medication and a disease-modifying therapy, which can help slow the progression and reduce inflammation, in addition to those other things, the exercise, brain health, etc. What is the best exercise for people with MS, or is it specific? I struggle with spasticity due to temperature changes, cold and hot. So it is definitely specific. However, I always hate that answer because it's so not helpful. So the way that I like to answer this question is the best exercise is going to be to do the thing that's hard as an exercise. So for example, if you want to stand up from a low chair like that, or a squishy chair like this one back here, or a toilet, like low surfaces, better, then practice standing up from low surfaces as an exercise. And if it's too challenging, because more likely than not, it's too hard, that's why it's one of your goals, make it easier. So see that pillow I have sitting up? I could put that down, and then I'm trying to sit on top of this pillow and that pillow. That's going to raise me up higher, so I won't have to sit down as low, and I won't have to stand up from as low of a surface. So you can make it easier. So that's how I try to give guidance of the best exercise. But at the end of the day, it's going to depend on not only what are your goals, but what's limiting you. You mentioned spasticity. So for you, a best exercise might not actually be a strengthening exercise, it might be a stretching one. If it's balance for someone else, it might be balance related. So there's so many factors that go into it. I would definitely encourage you to stay around for these monthly support groups because we do have a lot of conversation around those, like full conversations. This one's about remyelination. We have some specifically on spasticity, others specifically on strengthening, others specifically on walking. So check out some of those recordings and come back next month for all of our come back next month and the following months for these future conversations. I was just reminded, I believe, I'm pretty certain MS Visa News has another program very similar to this. So this is Moving with MS Virtual Support Group. They have a monthly event, I believe, where it is more focused on mental health. And I really think those ones could be great for not isolating yourself. I can't remember what they're called, but I would highly recommend going to MS Visa News website and look at all of their monthly events. Or if you're, I'm assuming you're already getting emails from them, open those emails and look for the one that is on, it's about mental health and community and engagement. So that could be really great for anyone that feels like you're isolating yourself. Michelle says, this is one of the best presentations I've ever seen. Thank you so much. Oh, I'm so happy to hear that, Michelle. Thank you for sharing. It is my goal to share what often is really complex in a way that's easy to understand, because all of this is it's so helpful to know, and it gives hope to know what's going on and what's being studied. So I'm so glad to hear that. Does using a TENS unit help with neuroplasticity? I have not seen research that supports that. I think that's the goal, but I have not seen research that says any type of TENS. There's lots of different options out there now, that it directly relates to neuroplasticity. As always, thank you. You're welcome. Don't be discouraged if you are an old timer. Yes, absolutely. Yes, thank you, Joe. The mental wellness chat. And again, thanks to Joe, it is called the mental wellness chat. That's the MS Views and News series, monthly series that they have. I have met with the host of that, Jessica Thomas, and she is a phenomenal human being. You are in good hands with her as your guide. It usually is the last Wednesday of the month, monthly. So lots of people commenting saying how very good it is. Awesome. Thanks for your feedback, guys. All right. Well, I will let you guys get going. Thank you so much for tuning in, for participating. I always really love sharing this information with you. So also thank you to MS Views and News for choosing me as your host for this support group, and Viatris, who again supports this whole series that we have. But I don't see any other questions coming in. Several people saying thank you, which I really appreciate. Thanks so much for hopping on. I will see you guys next month. We are the second Monday of every month, so I'll see you then. Bye, everyone.